Did you know that there is no reliable blood test to determine if you're in perimenopause? Perimenopause is best determined by symptoms. So today I'm going to reveal how you can tell if you're in perimenopause based on 3 simple criteria. So by the end of this video, you're going to have a clear understanding to tell if you're in perimenopause and what this means for your health. The first criteria is your age. So your progesterone levels start to decline at age 30, and generally by the age 40, you start to notice some of the symptoms associated with perimenopause, but it's not as cut and dry as this. Some females start noticing their symptoms in their early 30s. So the age criteria is fairly broad. If you're between age 30 and age 50, you are in the range. The second criteria is the onset or the worsening of hormonal symptoms. And we're going to discuss these symptoms in a moment. But this means if you've had these exact same symptoms and the exact same intensity, you've been struggling with them since you were a teen or since your 20s, you can attribute those to perimenopause. Finally, you would just need to have 3 of the following 9 symptoms. And again, these are new symptoms or worse symptoms since you've been past age 30. Number 1 is sleep disturbances, especially if that sleep disturbance is waking. So if you're waking up more in the middle of the night, generally between 1 to 4 a.m., that's a very classic sleep disturbance I see with perimenopausal patients. The second symptom is shortened cycles, 25 days or less. Symptom number 3 is a heavier or longer flow. Symptom 4 is breast tenderness. Number 5 is increased menstrual cramps. And number 6 is night sweats associated with PMS. Symptom number 7. Worsening or new onset of migraines. Symptom 8 is mood swings, especially things that I see in clients for this is increased anxiety and irritability. And symptom 9 is weight gain, especially when you're in that situation where everything that used to work for you is no longer working. The diet that used to work, the exercise you used to do to get the weight off, it's not even budging it. So let's review. If you're between age 30 and age 50 and you have a new onset or worsening of 3 of those 9 symptoms, perimenopause. If you fit this criteria, don't despair. There are so many great natural treatments to help get you through this transition. And I would encourage you to seek out these treatments and don't take no for an answer. You will run into practitioners who will do a blood test and say, no, you're not in perimenopause. But as I mentioned before, there is no blood test for perimenopause. The blood test was checking for full ovarian failure associated with full menopause. And perimenopause can start up to 10 years before menopause. You do not want to suffer needlessly for 10 years while you're waiting for a doctor who can find a blood test to show that there's a problem. Some practitioners may tell you that you're too young, and other ones will say you just have to deal with this. It's part of life. But you don't, and you don't have to struggle with this. As I mentioned before, there are thousands of patients that I've helped. You can often see when you get things balanced, you can see results in as little as a few weeks. With these treatments, I've seen marriages saved, jobs preserved, confidence restored, and the number one thing that I love to hear people come in and say is like, oh, I finally feel like my old self again. So if you tested positive for the criteria of perimenopause, make sure that you hit the bell notification and subscribe and stay tuned because I'm going to have a lot of videos sharing all of the secrets that I use for treating all of the symptoms through perimenopause. And I know you have friends that are also struggling with this. Share it with them too. Finally, click the link below. Take a free survey. You can find out exactly which stage of perimenopause you are in. Yes, there are multiple stages of perimenopause. You can find out where you are, what you can expect, and what's the next step going to be for you in your perimenopause journey. I'm Doc Yates. I hope this was helpful. Bye.